LANLUMA versus Sculptra. Could somebody have no results or minimal results with Sculptra and then all of a sudden get great results with LANLUMA? Is that even possible? And which one lasts longer? Should you switch from Sculptra to LANLUMA? What are the concentrations? What about safety? You'll be interested to know the same contents are in the vial. So you can see here, they both contain PLLA, sodium carboxymethylcellulose, and mannitol. They're carbon copies of each other. So why would one perform any differently than the other? And as you'll see, Sculptra is actually injected in a higher concentration. Sounds like you're being misled, right? Well, let's find out if you are. In today's video, I'm going to tell you all about it. And remember, biostimulators like Sculptra, like LANLUMA, like platelet-rich fibrin are up 37% over the past year as fillers decrease. I'm going to tell you exactly why that is, the nuances, everything you need to know. And yes, I was involved in some of the FDA approval trials for these biostimulators. I'll go into more detail. Let's pop in. So LANLUMA, I've gotten a lot of questions. Is it better than Sculptra? There are some people that did not get results with Sculptra and boom, got some results with LANLUMA. And there's some videos of these people who had multiple vials of Sculptra, didn't work, they got LANLUMA and it worked all of a sudden. So both LANLUMA and Sculptra have the same contents in the vial. What are you going to see? Poly-L-lactic acid, PLLA. That's the only thing really you need, but that's in each vial. I'll go through concentrations in a moment. The second thing, carboxymethylcellulose, CMC. Now this carboxymethylcellulose, it's also in something you may well know is Radius, and Radius has 70% CMC. CMC is found in your shampoos and toothpaste. It's a carrier. It does give you some filling and some effect, but you don't really care about that because it goes from the body in 3 months. And as we're going to talk about, you want 2 to 5 year results with these. And I'll go through which one's going to last you 5 years and which one won't. But that's your carboxymethylcellulose. So you have your PLA, you have your carboxymethylcellulose. There's a third component in both of these, and it's called sodium mannitol. Now, that is used to dehydrate the product because they come as powders. So it's just used in the manufacturing process. Cool thing is I get to go to some of the factories and learn from the PhDs who make this product, so I have a bit of insight into that. So that's in the products. Now, how could then somebody get no results with Sculptra and then all of a sudden LANLUMA get results? Well, there's a good reason. I'm going to go into exact concentrations, but understand this is the nature of a collagen stimulator. You can put it in the face on day 1, we repeat roughly at about 2 months, and then we reevaluate, and some people will get a third treatment. Let me tell you a story as an example. I have a patient come in, and it takes a couple months to get in to see me. I did her 2 sessions. She said, Rajani, I'm not seeing results. I need a third. Okay, great. I get her in. It's 2 months down the road. Beyond that, I could see her. She goes, thank God I didn't come in for that appointment. My face is now full. It kicked in. So likely what you're seeing is these people having the product just kick in, and they get a little extra LANLUMA, and they're getting a little more product, and boom, it kicks in. So it's not uncommon to do 2, 3, 4 vials, see not much, and then have it kick in over the course of 6 months. And understand, I will often concentrate this product if I'm not seeing results at the beginning. What does that mean? Well, these come as powders. So let's look at what we have in LANLUMA, okay? There's 2 vial sizes, a V and an X. X has more product in it. People often use that for the body. But if you take the V vial, you have 210 milligrams of PLLA. If you take the X vial, you have 630 milligrams of PLLA. Well, what's in a Sculptra molecule or vial? So you have 150 milligrams. So 210 would be your face vial of LANLUMA, 210 milligrams, 150 milligrams in your Sculptra. So clearly, you're getting less product in the Sculptra vial. But here's the thing you got to understand. The recommended dilution of that vial for LANLUMA would be 15 mLs. For Sculptra, I was involved in that approval trial where we went to 8 to 9 cc's and we were now allowed to add lidocaine per FDA approval. So you're talking about the Sculptra concentration of average what people are using, 8 to 9 cc's, comes to about 19 milligrams per ml. And if you take the face vial of LANLUMA, you're looking at about 14 milligrams per ml. So you're actually, the majority of people are using more concentrated Sculptra, but you're getting more gross product. You're getting more amount of product. Although it's more diluted, you're getting more absolute, would be the best way to put it, product with a LANLUMA vial. So it's like getting a Sculptra vial plus a little bit extra. So you're just getting more product. That's all there is to this. Same product, same collagen stimulation. Now I'm going to talk about scar tissue at the end and give you a link, but let's first talk about where someone might have a failure Sculptra. Let's say the person posting an anecdotal video. Remember, anecdotal means that's one person's opinion of what they've experienced. Very important to get that nice perspective, but understand I'm interested in thousands of people because you're not just one person. One person's experience will not relate to your experience. It's like saying RF microneedling, I had it done, it lifted my whole face. You'll go, 10 people will get that done and it won't give that same result. Not everyone has the same response. So understand there's a situation that's key for a female who might be late 40s, mid 40s, and this is it. So patient comes in and maybe I do 3 or 4 vials of Sculptra. Great. They get exactly to where they want to be. I got great results. Call them, they come in at 45, I see them at 46 and they go, Rajani, it's all gone. My face is hollowed out, or I never did get that response. If I measure their estrogen just before injection, and then I measure it a year later, I bet you it plummeted. So estrogen in a female leads to bone loss, collagen loss, everything else. And people will perceive, oh, it didn't last in me. No, you've aged quicker. Menopause, that area, people are going to need more treatments to catch up to the deleterious effects of the hormone loss that they're seeing. So you can get easily fooled by thinking you're not getting a response to Sculptra when in fact the aging rate, people are aging quicker. Add smoking, add poor diet, add poor sleep, and now you're aging faster than what the Sculptra has done. So that's something to keep in mind and understand. I'm going to be very concentrated on the bone of that female. I'm going to play off the zygomatic bone and the temple to get that lift out of the face. Also where the gonial angle, I'm going to go very concentrated because I'm on the bone. If they get a nodule in one of those areas, and it's extremely rare, 1 in thousands if you're doing it properly, even though I'm at a 5 cc to 1 concentration, I can go very concentrated because I'm on the bone. You got to know the layer you're in. So I can go very concentrated, especially in that female who's already losing bone. So where you place it, the depth you place it, the technique is hugely dependent on the effects you're going to get. That's why, again, you need to see a Sculptra expert. And it begs the question you're going to ask me, Rajani, why not put 3 or 4 vials in the face at one time? Remember, you want a controlled inflammatory process to get your fibroblasts, to decrease what we call MMPs, matrix metalloproteins. It really activates all the youthful factors in your face. But if you overstimulate it, what do you get? Nodules, lumps, and bumps. So the concentration that we use is key, and that's why you go to an expert injector. Now, I've done a minimum over 10,000 patients with Sculptra over 20 years, right? So as people use a lot of this product, as they become experts in it, we see the slight changes in the face, and we know therefore how to add and how much to add. So if you're talking longevity, we have good data on this. Of course, in my clinic, I'm doing 3D imaging, I'm able to see. But if you look at the trials from Sculptra, which again has the same product as LANLUMA in it, if you look at the trial, at 2 years they stopped the trial. Why? To get them approved. Why go to 5 years when you can get the product to market and make your money quicker? And so if we look at the data, if we follow the patients outside of the trial towards 5 years, they still had great results. Over 50% had great results towards 5 years. LANLUMA and Sculptra should last you the same amount of time based on the contents in the vial. So one will not last longer than another because remember, it's the same PLLA. Understand this, you might say, well, the PLLA, it's a bigger molecule of polyl-lactic acid. You can't do that. And the reason is you get granulomas. The size of the molecule should be around 40 to 60 microns. As we go over 100 microns, you get granulomas. That's where the body attacks it as a foreign body. Very different than nodules, which is from what? Clumping of product when it's injected wrong, reconstituted with water, because remember it's a powder, if that's done wrong, or if it's injected wrong. So the molecule size can't be that much bigger because of that reason you'd get granulomas. The body attacking itself, nodules are the clumping of product. Where would you never use it? Under the eyes, in the lips, around the mouth, concentric muscles of the face that are going to clump the product together. Never put it in the neck because even if 1 in 25 people, and we studied this well in 2009, a bunch of head and neck surgeons, plastic surgeons, we were injecting and we looked at the rate of nodules even at 30 to 6 to 1 dilution, and the nodule rate was way too high. What's that mean? If you get a nodule in your neck, you have to assume it's cancer until proven otherwise and biopsy that. So it's nice to sit here and say, oh, I feel a nodule, I don't care, but you might be worried about that, and it plays on the mind. I created a nodule on purpose on myself to follow it, and we usually do that in the preauricular area. What did I do? Injected concentrated Sculptra right here, created a nodule, had it for 18 months, but I'll tell you, you start to second guess yourself when that nodule is sitting there at 18 months, you go, that's a little long. Is it something bad? Preauricular nodes very rarely are a harbinger of cancer or anything bad, so I felt good about it. But you start to play with that. So if you got a nodule in your face, even though you don't see them, you can feel them, like we know from the HIV lipoatrophy days. They play on your mind. It's a very bad thing, so be very careful who's injecting and what you're injecting. PLLA goes away. It's not dissolvable. The longest molecule that I'm aware of histologically under the microscope that's been seen in the face has been about 23 months after injection. So PLLA goes in, stimulates a collagen, and then it gets absorbed into water, carbon dioxide, it leaves the body. And that process is, like I said, mostly the molecules are gone by 6-7 months. The collagen remains. Now, what about scar tissue? Well, I just had a couple of colleagues, in fact, get their facelifts done, and they've had Sculptra their whole life. It was time for a facelift. No problems with the surgery. I see that in many of my patients, but don't take my word for it. Okay, and we have Dr. David Sadat, also Beverly Hills, double board certified facial plastic surgeon.
Thanks for the question. So I think the scar tissue that we're talking about, for some odd reason, everybody thinks scar tissue is negative. Oftentimes in filling and thread lifting and using PLLA Sculptra, we're using this inflammatory response to get the result we want. So you want this scar tissue to work for you, to lift, to add volume, to make the skin texture better. So I don't think the scar tissue is bad as we know. So it's a negative effect that people think about, but it's not. Actually, this scar tissue is positive. Second thing I want to mention is that the type of facelift that we do nowadays is called deep plane facelift, which it sounds kind of weird, but basically what it means is that we're going underneath the muscle and lifting, and oftentimes thread lifting and all these other fillers are done on top of the muscle over the SMAS, an area that we call SMAS, fat underneath the skin. So we're kind of below the scar tissue, therefore making the lifting not so difficult. So the real question is it difficult to do facelift in someone who's had thread lifting? Maybe tiny little bit, but it can be easily done.
No, we know water's the carrier for this product, but understand, people on their own and in other countries, these products come, PLLA can be mixed with hyaluronic acid. It's a great combination. It's one of my favorite ones because then you get the immediate of the hyaluronic acid. As the hyaluronic acid comes down, you then get the Sculptra kicking in, and I love that combination. Now, you can make it up yourself which is perilous for most people because they won't get a uniform distribution of products. It will lead to clumping and lumps and bumps if it's not done correctly. But there are products around the world. Understand there's tons of products, not just LANLUMA, not just Sculptra. When I'm in Russia, they say, come teach me Sculptra. I'm over there. I'm in the operating room because they treat it as a sterile technique. They go, here, Rajani, here's your Sculptra vial. It wasn't Sculptra. It was a takeoff of Sculptra. So you'll find dozens and hundreds of these takeoffs of Sculptra around the world. Obviously, Sculptra is the most studied. It's hardest to get a US FDA approval than many other countries. And people are willing to spend millions and millions to get FDA approval in the United States because the reward is huge because it's the biggest aesthetic market in the world. And people in the US will spend as much money as it takes to look younger, to look youthful, and to maintain their look. There's a lot of money in aesthetics. It's by far the #1 money market in the world. So companies will invest in getting FDA approvals here in the United States. I'm in Europe, but you get the point. Here, I'm interviewing a couple of plastic surgeons from Beverly Hills who talk about the benefits of the inflammation of Sculptra and does it cause scar tissue along with threads. Keep your skin and body beautiful, healthy, and vibrant.